Ever heard that beep beep sound? You know, that terrifying sound often associated with a heart monitor. It's actually the sound of the heart's electrical activity being measured and monitored, and it is accompanied by some squiggly lines. Those are the ECG waves. Let's dive into understanding these squiggly lines, known as the ECG. What is an ECG? ECG stands for electrocardiogram, and it's sometimes referred to as EKG. It's a graphical representation of the electrical activity of the heart. The electrical impulses or waves that trigger the heartbeat are recorded by an instrument called an electrocardiograph. The ECG allows doctors to examine how well the heart is functioning, whether it's beating normally, and if there are any abnormalities in the heart's rhythm or electrical activity. Measuring ECG with leads. To measure an ECG, we use leads, which are attached to an ECG monitor. There are typically 3 to 12 leads used, depending on how detailed the reading needs to be. The most common method for a comprehensive reading is the 12-lead ECG, which provides a more in-depth view of the heart's electrical activity. However, for a simpler, basic ECG, a 3-lead ECG is also commonly used. These leads are strategically placed on the body in a specific pattern, which helps capture the electrical impulses from different angles of the heart. While we won't go into great detail about the exact placement of each lead, it's important to understand that their arrangement is crucial for capturing accurate ECG readings. For this discussion, we'll focus more on the 3-lead ECG, and we'll also explore some of the most common cardiac disorders that can be diagnosed through an ECG. Let's dive into the parts of the ECG. The P wave. The P wave is the first small, rounded bump at the beginning of the ECG. It represents the atrial depolarization, which triggers the contraction of the atria. This is the start of the cardiac cycle, known as atrial systole. Note, to understand systole and diastole better, refer to our short video on the cardiac cycle. In some cases, the P wave may be absent, which can indicate an issue with the heart's rhythm. Therefore, the P wave is not always a reliable marker for heart rate. The QRS complex. The QRS complex represents ventricular depolarization, which occurs when the ventricles contract. This marks the beginning of ventricular systole. Q wave, the initial downward deflection that signals the start of ventricular contraction. R wave, the upward deflection that comes after the Q wave. It's the largest deflection in the QRS complex. S wave, the final downward deflection that ends the QRS complex, signifying the completion of ventricular contraction. Thus, the number of QRS complexes is used to identify the heart rate. The T wave. The T wave is the hump-shaped wave that comes after the QRS complex. It represents ventricular repolarization, when the ventricles relax and return to their resting state after contraction. It signals the end of systole. The TP interval. The TP interval is the period between 2 consecutive beats. The phase of relaxation when the heart chambers fill with blood. This interval is important for evaluating the heart's rest period between beats. The common disorders found with the help of ECGs are 1. Atrial enlargements, diagnosed when there is enlargement of P waves. 2. Ventricular enlargements, diagnosed when there is enlargement of R waves. 3. Myocardial infarction heart attacks, diagnosed when there is enlargement of Q waves. 4. Atrial fibrillation AFib, fluttering of P waves. 5. Elevated T waves signify hyperkalemia, which is increased blood potassium levels. 6. Heart blocks. And many more. I hope I have made you understand the basics of ECG. Thank you so much for investing your valuable time.